A very good afternoon to all. Good health. A very good afternoon to all of you. Wish you good health for this COVID period. Myself, Dr. Imran, Associate Professor in the Department of Pharmacy Practice, Pharmacy Moga. ISF College of Pharmacy Moga is a NAC accredited A-grade institute in the territory of Moga, Punjab. That is the only institute in the pharmacy NREF ranking of 32 in overall India. ISF College Pharmacy Moga is degree, postgraduate, and doctorate courses. It's my great pleasure to welcome you all in this today's webinar of a dialogue series initiated by the ISF College of Pharmacy. Target audience for today's webinar is interns, residents of medical, pharmacy, and nursing, medical trainees in various allied care courses of healthcare. Pharmacy telecast its dialogue series under the guidance of our worthy director cum principal of this institute, Professor Dr. J.D. Gupta sir, personality among pharmacy fraternity and is very energetic leader representing academia in pharmacy. To J.D. Gupta to address the viewers for opening remarks. Great energetic that we address the audience. Due to some reasons, shortly available later on. I introduce teacher, Mr. Sourabh Kosey, Associate Professor in the Pharmacy College Pharmacy Moga. He is a young University of Bhopal, and he did his masters in pharmacy practice from more than 7 years of experience in research and administrative. His credit and member of various IB and Scholar, etc. This award and association and also from the best research paper award from the City University. He about 7 books and 28 research and prestigious utilization studies and community farming. Mr. Kosey webinar for today's session. Thank you very much.
You, Dr. Himraj, for giving a nice brief CV. We'll start with the webinar, third round of clinical integration. So, we would be touching on the insight issues of various prospects of ward round. We'll start with the proceedings. Let me have a brief introduction about the institution. ISF College of Pharmacy, Moga, is located in the India, Punjab, and this college is 36-year old, and all the affiliations to PCI, New Delhi, AICT, UGC, and IKG, UGG, Jalandhar. College is NAC A accredited and recently 32nd rank in NIRF rank category in pharmacy category. All the possible courses of pharmacy, that is D Pharm, B Pharm, M Pharm, PharmD, B Pharm, PhD. Particularly good extracurricular activity including principles of pharmacy, theory. So particularly we are all the possible causes of pharmacy and infrastructure wise, if we talk about the institution, we are having 419 classrooms, 7 seminar halls, 1 auditorium, 1 mini auditorium. The institution is divided into 7 blocks: administrative, IIPC, academic block, UG labs, PG labs, library, the pharmacy block, PharmD block, and overall we specialize less lab into the preclinical, clinical, paraclinical, and post-clinical dimensions of pharmacy. Analytical laboratory, which is a government-approved NABL CDS laboratory, along with animal cell culture, microbial cell culture lab, plant tissue culture, animal house, and herbal garden, including CAD lab, clinical research facilities, including human ethics committee, drug information center, and particularly model pharmacy, and coming towards the geographic lab, which is a recently innovated lab. Of affiliations and facilities like CPCSE, Animal Approved, Animal House, and IEC, Human Ethics Committee, ADR Report Monitoring Center, SPORE Student Chapter, which is International Society for Pharmacoeconomics and Outcome Research, Business Incubation Center, and lot of good practices are followed, academic practices over here. And before starting our session, let me throw the light over the technical achievements of the institution, such as patents, technology transfers, publications, and biodiversity of the students studying over here in terms of pharmacy. And lot of awards to the students, faculty members, researchers over here. More than 60 publications, book uh, being published by the faculty members of ISFCP. More than 35 private and government funded projects, which are a prestigious milestone in the history of ISFCP Moga. And we have also conducted 70 workshops, conferences, symposium, and hands-on practices. And along with it, we are going to the virtual laboratory, stimulation laboratory practices. The today's session, which is titled as Ward Round Participation, a Clinical Integration. When we come for the ward round, which is a term which is inside a hospital, and inside a hospital, paramedical and medical staff such as nursing, physician, physiotherapist, pharmacist, dietitian, radiologist, and lot of people work together in a team dynamic to have a care of a patient. So typically when going a ward round inside a hospital in inpatient department, Once we need to check the progress of the patient of his vitals, or drug therapy, medication therapy. As a healthcare professional, we should do and we should not do will be the today's presentation. So, pharmacy profession, along with the nursing and the doctor and physician, we are standing among the top five professions of the world to save a life of a patient. So, when the patient is going in the OPD department having a particular set of checkup, and when the diagnosis come, and the patient is referred to be administered in the admission in the inpatient department where a lot of medical and paramedical staff take care of. So to start with the presentation, I am version of Hippocratic oath which was given by Hippocrates. It tells that either it is a night time, daytime, or emergency time, we as a healthcare professional should take care of the patient. Okay, either it is inpatient, outpatient. Pharmacy, pharmacist oath is given by FIP, that is International Pharmacy Federation, as well as Pharmacy Council of India, which tells about the code of ethics and morals of the pharmacy profession. So now in COVID era, we would have seen that telemedicine is a trend right now because we cannot come outside the home. Patients generally into the mild, moderate, severe, chronic situation. The last part is intensive care, which is ICU, right? So once a patient is inside on the bed, we are required to not only treat patient with medicines or the devices, but also with sympathy and empathy. So once case is there in such condition when they are corona warriors, they are coming outside their homes, they are wearing PPE kits, masks, therapeutic gowns, head caps, and lot of gloves and putting over the care of the patients. So in generally, what the definition, if I go as per the WHO, ward round is a practice or a visit made by a medical or paramedical practitioner along with a team to identify the problems of the patient and the daily status recovery, which leads to the progression in the increment of life or quality of life in the disease state situation. Somebody is suffering from any disease state like diabetes mellitus, tuberculosis, if I say any heart problem, cardiac problem, any breathing airway obstruction, mild fever, or any state of disease, the patient when it is not curable at home, so we need to put in the hospital. So basically, hostel, and hospital. This both three terms comes from the Greek word, Latin word called host. Host means the place where you can take care of the patient, you can give the food, you can give the medicines, you can give the particular hospitality, you can give the things which is generally very much impressive for the patient. So as you can see in this slide, that particularly when treating a patient, not only a ward nurse or patient assistant, relative is involved. Everyone is involved. Suppose if the person is suffering from diabetes mellitus with hypertension, so it may leads to hypercholesteremia as a comorbidity, and in that particular case, diet chart is also required. So would have seen in the hypertension dash dietary approaches to stop hypertension. So a diet pyramid is there, but also in case of chronic kidney disease or certain things where we need to restrict our diet and salt consumption. So dietitian plays an important role. Then pharmacists like how to take medicine, when to take medicine, before lunch, after lunch, before meals, with milk, with water, with food, with juice, or with what? What are the various storage conditions? What are the label indications? Then coming towards the physiotherapist. Somebody is suffering from diabetes mellitus and there may be a chance of cervical spondylitis in that particular case, or in orthopedics, rheumatoid arthritis, osteoporosis, osteoarthritis. In that particular cases, we are required to go with the physiotherapist. And the physiotherapist will do the MRI and confirming some problem into the body, and furthermore leading towards the physiotherapy sessions. Then patient's personal behavior towards the disease and the cooperation with the team dynamics consisting of paramedics and in that particular things, all the things must be recorded very well. The medical abbreviation, genomics, and the particular kind of science symbols which is there in the inpatient, outpatient department must be symbolized in a very clear cut handwriting manner. The patient assistant and relatives plays an important role in the particularly coming to the ward rounds because sometimes the patient may be unconscious or semi-conscious. So at that particular time, we should tell the things to the relatives or the patient assistant. Then several kind of records like X-rays, radiology department, or certain kind of ECG, or source documents containing microfiche, or lot of admission documents. So documentation filing should be made proper during ward. A manager inside a hospital taking care of the accounts and the particular diagnostic imaging processes do take within the consent of the patient and the patient relatives. Then several times senior doctors may be required in an urgent manner, because what happens once a patient is over there and the patient is in the moderate to chronic situation of the disease state, at particular time a patient required physician's attention anytime in the daytime either or in the night time. Then junior doctors or interns became backbone of the medical system, where they stay 24 hours in the hospital and they make some resident notes, doctor's notes, ward round notes. Then coming towards the medical superintendent with the nursing superintendents, records, documents, and aids, give the telecalls, reminder calls of the medicines, documentation, and all that. Then a ward round is not as you are viewing in the image, like lot of people's putting hands in the pockets, surrounding the patient and telling that yes, it's like not a panic situation to the patient. So, what is the opening remarks? You should be very much familiar with the patient before going to the patient. You should greet him, her with sympathy and empathy, with a warm smile on the face, and telling how are you, how do you feel from the last night, and what are your medications going on? Are you taking medications on the time? Introductions plays a very important role. You introduce yourself with the white coat you are wearing, and you should not have a such kind of stare to the patient that the patient must be very much afraid to comment on his or her disease situation. So particularly case presentation, nursing notes, and along with the clinical pharmacist intervention and the sequencing. Okay, what happens once you are over there in a ward? So a client is over there in a ward particularly, and a management of the personal as a patient, either it is preparing for any surgery, planning mild surgery, or operation theater if you need to take the patient, and if there is some problem, we should go up with the particularly management of the environment and making feel comfortable to the patient. So making a checklist so that the patient should be comfortable with you to tell about the things. Yes, we are here for caring you. Usually, once a day a ward round is done. If the patient is critical, it may lead to 2 or 3 times round by a physician. Pharmacist participating in the medical ward round leads to promotion of healthcare and pharmaceutical care, like any drug information division requirement is there, any kind of titration of the doses is required, what are the various possible routes, and it helps to provide the rational drug use therapy. And there may be several examples of drug related problems like adverse drug reaction, and then coming towards the drug interaction, drug food interaction, and coming with the missed dose, or suppose sometime a patient is on polypharmacy consuming ayurvedic medicine, also allopathic medicine, it leads to the adverse effects and several health damages. Okay, so once you are going with the patient care inside a setup of a hospital setup, you should know the drug information services, and particularly the promotion of the rational drug users should be there. Via it only we can tell the patient life can be improved by such pharmacy care. So today's requirement is that we should go with the bedside counseling. Bedside, the patient is there, patient's status, patient's vital signs, patient's food history, and what did he consume last night, and is any other side effects, what are the various motions, they are proper or not, any vital chart monitoring is irregular, any kind of drug stop order is there by the patient, any new symptom or any kind of new I can say problem is arise, and with this problem, what is the treatment strategy like? So ultimately, what should be the individual's relevant goal or objectives to participate in the ward round is that we should tell that as a clinical pharmacist that doing ward round is a daily process. We need to see over the 3 to 4 aspects like past medication history, past medical history, coming towards the diagnosis part. Diagnosis consists of radiological, biochemical, hematological, diagnostic tools are different thing. Diagnostic criteria is something. Diagnostic criteria means there should be a range, like hemoglobin. In male it is different, female it is different. So there is one term called management, second is called as treatment. So everything is having a gold standard. Suppose we need to treat the patient. So for diabetes mellitus patient, HbA1c should be below 6.5 and done a quarterly investigation. So therapeutic goal is maintenance of that HbA1c, that is the glycosylated hemoglobin, within the range of 6.5 and 4. So that the person may be diabetic or mild to the diabetes, right? And providing information to the other healthcare professionals like nursing staff, then medical record department. There may be certain people such as diet. Suppose the person is required high fibrous diet. And vitamin B12 consumption is already inside the therapy of a prescription inside or outside patient. So there may not be required of fibrous food in the diet regimens. And optimization of therapeutic management. Optimization means exploration of the selection of the drug therapy, first line therapy. Suppose the person is suffering from high blood pressure. In high blood pressure, we should give diuretic first. There is reason. If you go with the oral hypoglycemic agents and the management of diabetes mellitus, so there is a reason. And for diabetes mellitus, as per the International Diabetes Association. And when it comes to hypertension, it is JNC at classification, Joint National Aid classification. Why I'm telling this thing is actually particularly when you are going for a ward round. This technical knowledge is good thing, but going with the knowledge of comorbidities and the pre-preparation of ward round leads to a better knowledge of healthcare profession as well as curing the patient. So once these are the various activity like taking over the what is the adverse drug reactions, what are the discharge planning, discharge summary, ward round discharge, and coming with the intralocated we can say things which leads to a better yield as an outcome. So when the patient comes, the situation is worse, but when the patient leaves from the ward round participation, a discharge medications, discharge points, discharge patient counseling bullet points must be integrated in the discharge summary, which leads to a particular what kind of introduction. So there, these are the 10 golden rules for the ward round participation. We should know in a timely fashion during pre-round that how many number of patients are available inside a ward, how many number of diabetes, how many number of hypertensive, how many number of tubercular patient, how many number of neuro patient. Likewise, we should have a list. And we should have a knowledge over the clinical diagnosis, and the diagnosis should be evidence based. Evidence based means the diagnosis should comply with the evidence. If our fracture inside the bone is there, we are going for an X-ray examination. Sciatica nerve pain is there, so my uric acid levels might be elevated inside my body. Suppose my diabetes mellitus and HbA1c level is high, so there may be a comorbidity called obesity. And for obesity marker, obviously there is body mass index called BMI. BMI should be if it is overweight, so we should tell that yes, particularly there are progression of disease. Diagnosis is multiple diagnosis, and we should rely with the timely that what are the drug therapy needed to be individualized in the patient or personalized ones. Second is reviewing of patient's progress. Patient progress depends on five things: sleep, vital signs monitoring. Third thing is the patient behavior. Fourth thing is what is the particular drug stock orders. And the last thing is the patient well-being, quality of life improved, and self-reliance and self-dependency in typical day activities such as bathing, cooking, going to the washroom, lifting heavy objects, and pushing the tables, chairs, lifting heavy objects with the table. Likewise, so increased muscle activity and quality of life. Need of monitoring parameters like we should not go with the further more elevated diagnostic parameters which leads to the extra burden on the pocket of the patient. So ultimately, patient is in the hospital stays, so patient is on job or on business. Already he or she is on the commerce. So, hospital admission leads to several kind of direct and indirect costs. Then decision and review on lines, like suppose there are some medicaments, parenterals, injections, several cannulas, plugs. So either the patient is in requirement of that particular drug therapies and interventions or not. Urinary catheters, drainage tubes, or certain kind of ventilation, airway obstruction. So we should not make extra surplus charges on the patient. So decision must be very much, I can say, concrete in a manner to reduce the indirect cost and direct cost of the pharmacology. Indirectly reducing infection. Infection may be of any type. Recently, we are going with the SARS infection, severe acute respiratory syndrome, which is a causative organism for coronavirus. So, in hospital, there may be chances of infection, not only to the patients but also to the medics and paramedics. Hence, it is suggested to take one vitamin C sublingual tablet that gives a sustained release to increase your immunity. So when we are going to the ward round, we are watching physician, pharmacy student, nursing student with the big pockets, aprons, white coats. These are for these reasons only to put stethoscopes, handbooks, e-books like this. So there may be chances of infection of hospital-acquired infection called nosocomial infection. Maybe some chances. There may be chances of infections of in the particularly airway or waterway or some hospital acquired infection, like several chances that we have seen with the hospital bed sheets, some skin disorders or diseases take place such as scabies or certain kind of things. So this will directly reduce infections. Then prescribing, de-prescribing, drug stop order, dose titration, or ultimately leads to the therapy. Either oral therapy we should go, intravenous we go. So basically intravenous or intravascular or parenterals takes place when the patient situation is chronic. And decision on the extent of care where appropriate on the fidelity of treatment. So once you are introducing a drug, there must be a proper indication, symptom, signs, etiology, or that particular rationale behind the use of that particular drug. A multidisciplinary improved form. Why I'm telling this thing? Because once we are in the patient's strategy, and patient is thinking that now we are having a similar output with the God. In India, physicians or doctors are considered as God. So when we are going with a healthcare team, not only physician but also pharmacists, nursing staff, residents, junior doctors, nursing superintendent, nursing station people are over there taking care of the patient. So along with treatment, healthcare management with the manpower management. Then discharge planning should have a summary with the medicaments, with the exercises, with the uh, follow-up, revisit, far off residence if it is there, telemedicine can be consultation. Communication of diagnosis and plans, therapeutic plan. Communication of diagnosis means if suppose there is blood sample withdrawn and smear test takes 2.5 days, so there should be a telephonic or mail. I should say that we can send the report. And the last purpose is like continuing medical education program and continuing pharmacy education programs, recent advances and the therapies which we are going to teach our nursing and physician. The right time, right diagnosis, right place is the foremost requirement and the outcome of the therapy. And we should unnecessary should not introduce any drug, any dose titration like so paracetamol is available into 500 mg, 650 mg, and 1 gram also. Maximum tolerated dose of paracetamol is 4 gram a day. That is 4,000 mg. Okay. So when the patient is when and so is required. So as per the prescribing guiding manual only we should give. If any adverse drug reaction or drug related problem is introduced, we should report to the ADR monitoring site located inside the hospital or on the Indian Pharmacopoeia Commission BAJ website. Then inappropriate adherence. Adherence means sticking to the drug therapy. If the patient is not on the drug therapy on a proper time, proper rest, it leads to problems. So medication adherence is one of the significant component of drug therapy. It provides a ample learning opportunities for the pharmacist also, a clinical pharmacist. needs to the first hand drug information, and for that purpose they can use several mobile applications also inside the phone. Reference like Lexicomp is there, Micromedex is there, the Medicine Complete is there, Pets.com, Medscape. So there are a lot of drug information services as an application are available inside the particularly your mobile, so can refer, one can refer and have evidence based medicines. Now, as a pharmacy college and a pharmacy teacher, I would like to highlight the importance and significance of pharmacists, clinical pharmacists in wardrobe. There may be chances of development of spontaneous ADR, and it's under reporting. Under reporting means we know there is a several drug related problem called adverse drug reaction. Okay. And ultimately, adverse drug reactions means pharmacovigilance. Pharmacovigilance is basically made up of two words, pharmakon, which is a Greek word which means drugs or medicine, and to check to adhere. So pharmacovigilance nowadays are of various types like material vigilance, immovigilance, herbovigilance, edura vigilance. Now, what is material vigilance? We are doing quality assurance. In quality assurance, we are preparing medicaments. So, in sophisticated instrumentations, what we are preparing, that material, as the raw material as well as equipment, sophisticated, must be full free from contamination. That is called as material vigilance. Second thing I said is chemovigilance. Chemovigilance means blood related ADR. Hemo means heme protein, okay, blood related component. If heme protein is directly causing any causal relationship with the blood transfusion, ADR, adverse event, or certainly storage of the blood inside the blood tanks, and it's like storage situation and proper plugging systems. If any power cut is there, so the refrigerators must be connected wisely to the this. So this is called as hemovigilance. Third thing I told is herbovigilance. Herbovigilance means only herbal drugs are over there in applications. In COVID-19, you would have seen Baba Ramdev from Patanjali Yogpet introduced Coronil. So again, it was counted in drugs and magic remedy acts because there was no such facts telling that particularly this medicine is going to protect your immunity or going to enhance your immunity as a immunosuppressants. So last thing after hypervigilance is edura vigilance. Edura vigilance is particularly a system where we are checking vaccine related vigilance. Pharmacovigilance along with the periodic safety update report of individuals and individual case safety reports of the healthy volunteers as well as the disease volunteers during clinical trials. So, definition of pharmacovigilance as per WHO says that assessment, reporting, monitoring, and the reaction towards the any adverse drug reaction we should go after. So at the opening with the patient greetings as a pharmacist, we should confirm patient ID number called inpatient number, patient name, age, sex, and ultimately past medical history, past medication history, family history, social history, chewing tobacco, smoking, alcohol consumption, antisocial habits, and ultimately past medical history, any genetic familial history, like some diseases are genetic, like when we go with the diabetes mellitus, we will see that a patient is pregnant and suffering from diabetes, it leads to the newborn baby also. Okay. So in certain cases, some are genetic disorders like if 21 microsome in our body is not there, it leads to several kind of Downs. Okay. So ultimately, a case reading, subjective, objective assessment plan, and particularly the introductions and what are the pleasantries, how you are treating the patient with sympathy, empathy, and the case presentation in the end. Case presentation, introduction, and various kind of things as a individual vitals, individual drug regimens, individuals biochemical parameters, and etc. Then consultation comes as like patient feedback, request, discharge summary, physical examination, blood pressure, hypertension, respiratory rate, cardiac rate, pulse oximetry, and all the vital signs monitoring must be done in a manner so that we should come to know that yes, when the patient's basic body structure is functioning very appropriately, it leads to a particular kind of communication, and the communication basically verbal or non-verbal Doing patient counseling, inpatient counseling, particularly preparation of patient information leaflet. Information leaflet is a non-verbal communication into which we go with the ease reading phase, ERF. So when we are preparing a patient information leaflet, which leads to two things. One is pictogram, and another thing is called as the syllables. Means number of pictures is pictogram, symbols, syllables is the words. To check out the efficacy of this particular FRA flash reading is, we should come to know that the effectivity of the patient information leaflet is very good. And at the closing remark on the farewell terminal of the ward round, we should tell the patients the instructions and the care to be taken, and breaking the co-presence and making her or him comfortable, and addressing her is questions regarding health status. So typically, classification of ward rounds is generally of 4 to 5 types given in 1997. One is indicate. Pre means before rounds. Registrar or resident rounds are the rounds made during day in the morning time and one in the evening time. And third one is professor or chief round. It is called as professor, senior medicine professor, as well as the medical intern, leads to several conclusions. Several, if the case is critical, at that critical point of view, what are the problem, taking decision, initiating therapy, well-being of the patient. And the fourth one is the teaching rounds. Like in an examination table, the patient will be brought from the ward and will be asked to just demonstration table. The patient will be there and leading towards the particular individual signs and symptoms, etiology, epidemiology, and the diagnosis with the pertaining treatment. So, what is pre-rounds? Usually by interns, medical postgraduate students, nursing, PharmDs, pharmacy practice, or any person, the clinical pharmacist, hospital pharmacist inside a ward capacity, knowing the patient status, diagnosis, disease management, therapeutic plan, medicines, any undergone therapy, surgery, any kind of thing which leads to give the clinical review and interventions. Second one is called as resident rounds. Resident means a person residing inside the hospital for a longer period. Else the registrars, residents individually or the team conduct workshops. So at least once a day at a fixed time, usually in the morning or in the evening. This is a mandatory manual, significantly leads to the recovery or leads to particularly, we can say that the progression of the disease state of the individual admitted inside the hospital. Just try to check out the practical knowledge about the disease situation and the patient. Because usually a physician a day in outpatient department 50 to 30 patients they are dealing with, and inside a ward round 50 to say 20 to 30 patients are over there, which is a lot of clinical pulse in terms of experience. Next one is the teaching rounds or the professor rounds. In this, the teaching hospitals, say tertiary care teaching hospitals, surgeon, neurology, cardiology, nephrology, urology, ophthalmology, skin and body, gynecology, lot of organ system. There are 12 organ systems available inside the body as per the human anatomy. So specific HODs of the departments, along with the clinical pharmacologist, clinical pharmacist, and the specific healthcare professionals goes and conduct the patients in the certain area, so that the challenging cases like medical legal examination of rape cases, several casualties, or tragic roadside accidents, or particularly if any kind of medical disasters such as earthquakes or any kind of we can say thunderstorm is over there, and into it if any kind of injuries are there into the patient which is critical level, at that particular level we need to require to see within the professor and chief rounds. Teaching rounds in a teaching hospital, academic medical staff conducts bedside clinical teaching. What happens when we go with the medical interns, medical MBBS first year, first form, second form, third form, nursing, pharmacy, and medical paramedics, including the residents and pharmacy students, usually go within the extensive round and conducted only few times a week, because it is an educational purpose round. It's not a daily practice, but for stimulation, video recording, or for educational purposes, like this kind of ward rounds are being conducted to inculcate the clinical phenomena which leads to the improvement into the drug knowledge and medicine information services. Hence, I say that teaching rounds is a must part of medical paramedical practice. So now important aspect is one is going for a ward round. What he or she do? Informations, patient healthcare status, disease management, past medical history, or certain kind of participation in clinical decision making. So, pre-boardroom is like seeing the past medication history, medical history, family history, checking the laboratory investigations, biochemistry, probably board round sequencing, and also going with the overview of drug and disease. Like, suppose is there, and in that particular case, if the patient is not receiving within the drug therapy of a column, and if I say that yes, a pre-ward round process which is arising during a ward round is to know the patient about the its existing knowledge, pre-existing knowledge, so that when we come several times, senior physicians asked questions to the residents, to the interns, to the family students, narrate the case, tell about the case, what is your medical opinion, what is your instance about the patient current scenario, clinical scenario, what is the choice of treatment. So pre-ward round gives you an assumption of a real ward round. And in various kind of hospitals, it is called as on-the-job training, OJT. So identifying the DRPs, the classification is given by CIPOL in 1988. There are 8 kind of drug-related problems, which on the further slides I am going to discuss. Remedial action for the identified drug-related problem. Like drug-related problem is available, and for the drug-related problem, what is the solution of the problem? And maintenance of individual patient profile form, patient notes, patient diaries, summarizing the drug information relevant to the patient drug status therapy, and preparing a checklist of diagnosis. You should have with your hand medical dictionary. So particularly what is the steps or standard operating procedure for ward round is acknowledge the patient in terms of diagnosis, in terms of therapy, in terms of anticipating the treatment, management, therapeutic goal, and ultimately the communication process. Either it may be clinical or non-clinical, verbal or non. You should have, might have seen in the physicians that they wear a long white coat called white coat, and that white coat are having long pockets. So in that pockets they used to have several kind of pens, mobile phones, stethoscope, turning fork, and particularly some handbooks, medical dictionaries, handbook of pharmacotherapeutics, Martindale, or medical dictionaries, handbook of pharmacotherapy must be there. In Indian scenario, National Formulary of India should be there. It is a concise handbook size. Now recently in running is 2016 National Formulary of India. By the month of December 2020, we will have new National Formulary of India. Along with it, we should have SIMS. Full form of SIMS is Current Index of Medical Specialty. It is a quarterly publication in Asia. It costs 130 rupees. So SIMS give you the brand names information. Other pages at the back side where you will have the brand equity, brand information, whose who its cost, available company, brand name, the pharmacological class, and the various kind of contraindications, dose, route, and particularly time to take the drugs. Recently, chronopharmacology in 2018, when Nobel Prize was given on circadian rhythm. Circadian rhythm means when we take the medicines in the daytime or night time, as per our biological activity of body, effective more in morning time, some are effective in evening. Quote with one example, in hypercholesteremia situation, statins must be given in the evening. Then drug today is like also one of the available ready-made option. Then at the physician's desk there is the PDR. ADR means physician desk reference. So recently 2020 74th edition is in the working scenario. WHO model drug list called as essential drug list. 1977, WHO gave first model drug list, and after every 2 years we are having one model essential drug list. And it is electronic also nowadays available. It is a more than 4 decade available essential medical list with 554 medicines, a lot of publications, pregnancy category, A, B, C, D, X, as well as the brand name, dose, form, also disease. Disease is like of ITC classification, international classification of disease. ICD classification 11% right now inside the, and the second one is ATC. ATC is called as anatomic therapeutic chemical classification. So why I'm telling this thing, because once you need to particularly do the things in a manner, because once we are doing the things in the scenarios, we should have an evidence-based medicine system. What is the evidence-based medicine system? Like if I am telling that paracetamol reduces pyrexia, okay, means like fever reduction. Then I can show the Indian Pharmacopoeia monograph, and I can tell that in the National Essential Disease Drug List, it is coded as COX-2 inhibitor, and which leads to the prostaglandin synthesis, and ultimately it leads to reduce in the lactic acid inside the bodies and reduces the pain. So why I'm telling these points, that National Essential Drug List, there is a core committee which sit over the list and decide which drug has to be there inside the as per the organ system. Practical tips for having the wardrobe: you should have the all primary, secondary, tertiary resources of wardrobe, formulary, pen, patient profile form, various kind of appropriate working references, SIMS, MIMS, BNF, IP, drug review, mobile applications, drug related problems, DRPs, and a lot of good things which leads to the particular kind of situation. And we should not conclude or run over a diagnosis disease. Do not, I would say that you should not argue with the physician stating that particularly your medical diagnosis or medical decision on the treatment, drug therapy is not appropriate. Within the team dynamics, one should work on the background, either medical professional or paramedical professional. There are several pharmacist intervention is made during the part. And intervention means several kind of conclusion remarks which leads to the better quality of life of the patients, and which results in the change of management of drug therapy. As and interventions may be active, passive, or reactive. Now, what is active? Active means with the help of evidence-based system, gold standard guidelines, prescriber manual, or particularly backed up by the personal visit, influence, prescribe. So, WHO prescribing manual given in 1994 states that this is needed to be, and it should be particularly within the evidence-based system. And passive is like suppose somebody used to ask what is the use of one would tell that it is used as antibiotic analgesic, it reduces pyrexia, it is a toxin another available option. So with the first line treatment, second line treatment, and the gold standard of the therapy. Third thing is reactive. Reacting is a clinical pharmacy work where we need to rationalize the drug therapy and every individual parenteral, oral, topical application typically used. What is the rationale behind that pharmaceutical therapy is used? So coming with the asking questions or several kind of prescription audit practices. And particularly we can go with the dose titration. As I quoted the example of paracetamol. It is available in 500 mg, 650 mg and 1 gram. 1 gram maximum single dose I am telling. In chikungunya case, 1 gram paracetamol, 1000 mg is used. So, particularly with the dose or frequency, any drug stop order or any contraindication. In the month of September 2019, you would have seen with the drug called but H2 receptor antagonist drug was stopped by USA. Then India also contraindicated that drug is taking medical order from CDS to New Delhi Nirvana. But ultimately the drug got contraindication clearance. Second example is thalidomide in 1957 to 62 in United Kingdom. This thalidomide drug used to have the congenital anomaly of birth defects in the United Kingdom. Now, also, this thalidomide drug is available in the market with the indication of leprosy. The choice of medication or drug or particularly dose titration is about. Adverse effects. Suppose a nursing staff is trying to intervene a vein inside a patient, and if the vein is not detected 6 or 7 times, the application of syringe needle is over there, which leads to the marks. And the adverse effects. Time and for the reduction of this adverse effects, when we must be used. Another example is administration of insulin at the pancreas within the beta cells at the stomach. So while doing multiple transition of insulin, which leads to the particular kind of adverse effects in the marks. In Herz-Zoster case, if your body is having infection at the Herz-Zoster, particularly it leads to the mark. Then drug interaction. Drug interactions is of classifying four types: interaction, drug food interaction, drug disease interaction, and drug polytherapy. So drug interaction leads to a certain kind of synergistic effect. When it is positive, it is called a synergistic effect or fixed dose combination. When it is adverse, then it is called as drug interaction. And with the food, like some grab juice or milk, with milk without milk, water, some fruits we should not take. And coming towards the formulation, it's administration technique. Suppose to the small children who used to do, we will take one tablet inside a small glass, we will put some water. With a teaspoonful, we will use to titrate it, blend it, use to give it. So it is reducing the efficacy. And duration of the therapy, ultimately there is some drug treatment available with the duration of therapy. Suppose malaria, incubation period is 2.5 days. COVID, we are telling that we need to quarantine the patient for a couple of weeks, say 14 days. So every disease is having a incubation period as per the vector, airborne or waterborne or virus borne, microbes. So it leads to the duration of therapy. And action uses of pharmacology, like pharmacology is another branch of pharmacy. Logics of pharmacy is called as pharmacology. So preclinical part, clinical part, paraclinical part, and post-clinical part of the medicament is needed to be cross-verified, checked. And the inventory aspect again is a bigger point because somebody is trying to have the vaccine trials or the drug trials is availability and raw material is one of the things. Generic and branded is another aspect. Identification of patient medications for admission because sometimes the patient may be on medications for chronic diseases such as asthma. And the patient a long time is dependent on the medicaments as called as uh, like chronic diseases. Legal and administrative issues like surgery and operation theater, minor surgery, patient assistant of patient consent as per the biomedical ethics and declaration of patient must be taken out of care. And certain vaccines and storage conditions inside the refrigerator and like oral polio vaccine and particularly like pentavalent vaccine. So particularly what drug where it is to be stored, infusion form it is also. Communication is a vital process. Account consisting of close proximity within the staff, with the staff, paramedical nursing, writing, physiotherapy, so this all the things must be taken care of. Effective communication skills and clinical knowledge are prerequisite. I am telling these things because good interpersonal relationships are a key of success. In the hospital, team dynamics plays a major important role. Sometimes nursing staff make a intervention of expired medicine, which is available inside a hospital pharmacy. But it is not so. What it is used to do is, particularly when we would see that uh, I say that particularly learning of regional languages and particularly having several aspects of, I would say, patient behavior. Suppose the patient is in Tamil Nadu, hospital is in Tamil Nadu, you should have little bit knowledge of Tamil. Suppose you are in Punjab, so in Punjab, if you will talk in vernacular or regional language, the patient's empathy will be more. And be cautious on drug related problems, issues on the ward round, and avoid doing chit chat and doing a lot of kind of problems such as taking snaps, photographs of the patient profile forms, laboratory investigations, which ultimately leads to the problems. And not to cross-challenge a medical practitioner integrity, a diagnosis, or a medical disease. What is the follow-up of ward round? After doing a ward round, residents is needed to mark particularly documentation, and on the documentation we need to have a particular kind of category such as what to take, when to take, how to take, and particularly what food, specifically in terms of several kidney diseases and several time some kind of things such as tonsillitis, and at that time your mouth may not having taste, so oats or certain kind of things like khichdi dalia is also provided to the patient. Concluding slides, a pre-word round, what is needed to be required. We should update with the junior doctors. We should make a list of the drugs. We should make a list of the diseases, patients, their past history, and coming to a conclusion. And during word round, make the notes, listen to the physicians clearly, to the clinicians. At the last, ensure the cross process of evidence, clinical once you are going to learn with the process. Then follow up through the decisions, registrar of orders, even nursing superintendent, senior nursing staff is telling any update like adverse event. Any assistant is telling that what are the drug therapy needed to be asked, and what is the role of pharmacist about the drugs, like pharmacovigilance, like about dose adjustment, like any drug stop order, concurrent therapy, new drug therapy, like. So there are certain things which a paramedical staff, as per the patient, as per the disease, as per the care, advocacy, and the most good thing is like a good physician do not treat the patient with the medicament. They treat with the sympathy, empathy, and treatment. So once meeting patient, you should not stare, look, or give us such a medical eyeline impression that the disease is very chronic and it is ultimately going to affect your life. And if discussing with the patient any alteration of the therapy, follow up, next revisit, and taking the diagnosis, solve the things. The patient without any kind of embarrassment or any kind of, I could say, the past medical history or somebody is like on narcotics, psychotropic substances. So it should not, you should give an impression that you are an antisocial element of the society. I should not treat you. The diagnostic criteria, therapy, and all the things is made in a such a way that the selecting patient therapy route goes kind of therapy, it leads to maintain the quality of life. So pharmacist plays a vital role in the ward rounds, and clinical pharmacist operation management of medication leads to prescribing, overprescribing, or having good computer operated pharmacy entry, and particularly LASA errors needed to be reduced, and particularly length of hospital stay must be reduced as per the pharmacotherapeutic choices or interventions made by a pharmacist. And gaining a pharmacy care, a pharmacist should be registered and a medical practitioner, and ultimately, which leads to the academia, research, and identification of cases of clinical treatment. Pharmacist in background participation is very significant and extraordinary. When it comes to the participation, its availability, pharmaceutical services definitely is leading to enhance the accuracy of treatment, patient safety, and various kind of drug-related problems, ward round checklist. These are the classification of DRP, medical related problem. Symptoms of medical related problem be like anxiety, insomnia, delirium, depression, confusion, false loss of appetite, anorexia nervosa, weakness, lethargy, inconsistency. Things. We need to immunize the when the person is taking 11 months. Booster doses must be followed. And particularly pharmacotherapy consults, disease, anticoagulant therapy, medication safety surveillance, and public health, wellness, and public health care must be taken. It is an integral part of taking patient care. Once the pharmaceutical care is not good, it may lead to the worsening of the disease state of the patient. Progression from mild to moderate and moderate to severe. So, word round summary is like one page summary where over any changes, impression, diagnosis, clinical management or judgment, which is new morbidity, certain kind of things, imaging, discharge care, and the person who was on the ward round, its his signature and all the valid things. So then this is the last kind of interventions we needed to take. That what I saw, what else I saw, what do you think, what goal are we trying to achieve, and what are the helps from our medical experience we should give to the patient and other healthcare professionals. Similarly, another what summary and like plan, take, study, the components of ward round, particularly management of patient care, personal management, management of supply equipments, management of environmental cleanliness like central supply units, and the therapeutic gowns, dresses, therapeutic footwear, and fumigation of operation theaters and the wards, and specifically the things which are ultimately going to take a proper patient. So management of patient care must be a client care, patient care, paramedic medic care, and nosocomial infections, any kind of bed from bed distance, nosocomial infection takes place. So the nursing of the pharmacy students on the ward round must take vitamin C tablets available in the blood name of Limcy to increase the immunity during ward rounds. So also I have covered all the parts of ward round participation during this particularly word round, what are the pros and pros, what are the do's and don'ts, and what are the things we need to implement in our nature so that particularly patient care technique is enhanced. So over to Doctor for next critical remark or if any questions are over there.
Thank you, Dr. Kosey, sir. Thank you very much for your nice and very elaborate session on background participation and clinical integration. I, on behalf of Director of thank you, management, and Dr. Praneeth Kumar, who's technically looking after all this session, and all the management authorized this to operate this webinars your institution. This type of clinical interventions. Thank you very much, sir, Professor, for your elaborated session, and I hope you will continue this spirit for the further webinar sessions. On behalf of ISF, I thank you very much for viewers who are joined and gave their comments. Very informative and very persuasive comments we have received from your side. All the viewers, thank you very much for today. Thank you very much. This is the overall for this webinar. Thank you very much.
Thank you so much, Dr. Hemraj and Dr. Pani.